There's concern that the so-called Nipah virus could enter the Philippines and, naku, baka kumalat pa. Should we be worried at this point? Let's ask our ever reliable infectious diseases expert, Dr. Rontgene Solante. Doc, welcome back sa Afternoon Delight. Lord De Vera po at si Tita Pauline Versosa.
Good afternoon, Doc.
Hi, Lord and Pauline. Good afternoon.
Opo. So, Doc, may na-record na Sultan Kudarat at ang sinasabi po ng mga artikulo ay may epidemic potential daw itong Nipah virus. Ano ho ang dapat pangambahan sa statement na yon, sir?
Well, yes, no, there's a possibility na pwedeng kumakalat ang Nipah virus infection because the fact, Lord, no, nagkaganito na tayo noong 2014, it doesn't also mean that we cannot have another outbreak, no? This is a zoonotic type of virus, meaning merong hayop carrying this virus, and that most of the infections are the transmission coming from an infected animal going to the human. That's a bat to human transmission, or any infected animal from the bat, and then that particular animal will be contaminated, exposing the human being. Doon ang source ng infection. So that's a reality. It can happen also in the Philippines, but as of now, I don't think we will be. This is something that we need to panic, or you just need to be aware that there's something and there's an ongoing outbreak in India.
Opo.
Is this a new mutation, Doc? Itong Nipah virus, as you mentioned, noong 2014, nagkaganito na rin. Pero ito bang bago, mas malakas ba yan? And what are the symptoms that people should know about?
Okay, Pauline, Nipah virus is carried by a particular fruit bat. And some of these fruit bat that are carrying the virus are also common in countries like India, Bangladesh, no? And the first case was reported in Malaysia, no? So there is no mutation of this virus. It's just that people are more exposed to the infection because of like urbanization. No? It's one of the most common cause now of why people are getting. We have a lot of this outbreak, increase in the population, and then in that manner there is also disturbance of the animals that are carrying this virus, and then more interaction with the animal carrying the virus with human, and that's why there is now a periodic outbreak of Nipah in this country.
So, halimbawa, Doc, isa sa mga talagang unforgettable images ng panahon ng COVID, ay yung paniki supposedly na nasa soup. Ito, fruit bat ang nagdadala usually ng virus. So, pag may kumain halimbawa nung paniki, nung laman ng paniki, kahit lutuin ng maayos, delikado ho ba yun?
Well, kung fully cooked naman, Lord, walang problema. But one of the most common cause ng infection ito, like, for example, there are animals that can be infected with the poop of the paniki, like yung horses, goats, or even pigs, And when these domesticated animals will be infected, that's the route of transmission where it can also affect those who are taking care of these mga domesticated animals.
Pagdakagat.
Oo. So, Doc, what are the symptoms and when does a Nipah virus become fatal?
Okay, the initial symptoms of patients with Nipah virus based on the data is that it's like a flu-like symptoms, Lagnat, sakit sa ulo, sakit sa katawan, And then pakonting ubo-ubo. But this type of virus is really known for its higher fatality, Mataas ang mortality nito, Lord and Pauline. Why? Because there is this virus that has affinity in the brain. So it can cause severe brain inflammation that can also have a higher rate of fatality. And at the same time, the other form of the infection is respiratory. So you can transmit this through coughing or severe coughing without wearing a face mask, and you are within 3 to 4 feet of that individual. So that's the danger of this virus because it can be highly transmissible, especially patients who had symptoms.
O pamamaga ng utak maliban sa baga, Pero Doc, wala pa rin daw ang vaccine para dito. Although last year daw, nag-test na raw yung Oxford, pati naman yung mga Moderna at AstraZeneca. May balita na ho ba kayo tungkol kung ano na development sa mga experiments na yun, sir?
Okay, based on current data, the vaccine is not yet available. They are still in the phase 1 clinical trial. So, kumbaga sa laboratory pa lang ang level na tinitingnan kung ano yung mga antibody response based on the animal na binakunahan, no? But not yet on the phase 2 or phase 3 level of the data. So that's why it's considered, Lord, a high priority pathogen, because if this will be infecting a person, mataas ang mortality, tapos walang bakuna at walang gamot for the treatment, and that's the reason why the WHO considered this a high priority, meaning they encourage scientists or any other entities to come up with vaccine or come up with treatment.
Yung fatality level niya raw, nasa 40 to 70%, sabi ng World Health Organization, Doc. At okay, Doc, yung human-to-human transmission, sa anong paraan po ito, sir?
Okay, so in an event that a human is infected and became symptomatic, no? So ibig sabihin may mga sintomas na siya. The most common mode of transmission is when you are near with that particular person, and the person will cough without you having the mask. No, we call that droplet transmission. In some cases, there were also reported airborne transmission. So meaning the organism can be airborne, can last in the air for a longer period of time. And the third one is body fluids. No? So any fluid coming from that body of a person that is infected, and then when you touch it without wearing gloves, and then you touch your mouth, you touch your eyes, then that's where you can also get the infection.
Naku, Dok, parang nakaka-alarm, no? Because it's highly transmissible. Mataas din yung mortality rate. But why should Filipinos not panic at this point? And are there people also na at more risk dito sa Nipah virus na to?
Yes, why we should not panic? Because I think our government is also monitoring, no, the event. And I think there are already measures that when this infection will be, sana hindi naman darating dito, the lessons we learned from COVID, making hospitals and other institutions be prepared for any outbreak or epidemic, that's something that we have learned, and our Department of Health also has made some progress on that. No, paano natin, how we should deal with mga ganitong klaseng mga kasong possible outbreak or epidemic.
Doc, may stupid question po ako. So, habang dumadami kunyari ang mai-infect dito, ay mas malaki rin ang chances na mag-mutate pa siya?
Well, looking at the articles, no, in some of the scientific paper, the Nipah virus, more or less, no, it's not unlike your influenza virus, which is always prone to mutation, or your COVID-19. That's not a stupid question, Lord. That's a very good question. The Nipah virus doesn't have that much ability to mutate. Mutation will only occur if there is really widespread transmission of an infected or of those with the infection.
Buti na lang.
Oh. Doc, let's discuss treatment options naman in the event. Sana naman hindi po, no? Pero kung dumating nga po talaga ito sa Pilipinas at kumalat, are our hospitals ready to treat patients? What would treatment look like considering this involves inflammation in the brain, pati na rin sa respiratory?
May madadaan lang sa Vicks Vaporub, baka hindi.
Tsaka paracetamol.
Okay. Yung mga na-admit, no? Like for example, if there is brain involvement, so ang mangyari niyan, they will be closely monitored. They will be, like for example, if there's brain inflammation, kasi ang problema dyan, masisira din yung mga other organs mo, no? Especially the ability to breathe, no? So, nandun naman yung mga mechanical ventilator, nandun din yung mga IV fluids. So, it's purely supportive. You just have to give the most important supportive care and hopefully pray that that person will recover. Pero importante pa rin dito, the early diagnosis, early management will be very crucial for people that are vulnerable, no? Vulnerable population, yung mga matanda, may mga comorbidities or yung mga bata.
May magtatanong pa sana, Doktor, sa diverticulitis at kung nakakahawa daw ito. Pero wala na pong oras. Nagpapasalamat po kami sa oras na binibigay niyo palagi sa amin. Dr. Rontgene Solante, always a pleasure having you on the show. Thank you, Doc.
Thank you, Lord. Thank you, Pauline. Bye-bye.
Thank you, Doc.